I grew up watching my father and Bob McAfee in many serious and many not so serious moments. Bob, like my father, believed that it was important to bring the world outside medicine into the discussion. And he was like my father as well in that he had tremendous courage to take on the tough issues of the day.
There's not a part of public health in Maine that has not benefited from Dr. McAfee's leadership.
He was president of the AMA at a time when there was a lot of uproar about the healthcare system, and I think he was very instrumental in helping to stabilize that situation.
There are certain people that when they enter a room command a certain presence and a certain amount of attention, and he's one of those people. People want to know him, they want to listen to him. He has an enormous intelligence and intellectual curiosity and an enormous amount of energy to get things done.
Bob McAfee was the first person I met from the University of New England. He chaired the search committee that brought me to Maine and to the institution. So Bob changed my life. I will always be indebted to him for giving me the opportunity to come to Maine and serve the university.
It's a lifetime of accomplishment that someone goes from, he started out healing people and making sure that people could be well and enjoy life. Then he got onto the bigger stage with the AMA, and I think that brought up all kinds of interests that he has around handgun safety, around children's issues, around social justice and equality, around the economics of health.
He has worked for 8 governors. He has chaired everything there is to chair. He has been the most consistent leader in public health. His work in preventing domestic violence and getting the American Medical Association to have as a priority the prevention of domestic violence and training physicians to screen for domestic violence will be his great legacy at the American Medical Association.
He's a very good collaborator. He did a wonderful job at bringing together, medicine in the northern New England area, in Maine in particular.
Bob McAfee is the consummate bridge builder. And one story I think that illustrates that is when the Hanley Leadership Award was being established. He was very supportive of Steve Shannon, who was then the Dean of our College of Osteopathic Medicine, to be the recipient of the first Hanley Leadership Award. And I know that Bob has told me he felt that he did that in a way to bridge some of the differences that occurred, and this has been well over a decade ago, between the DO and MD community.
He was really a great surgeon. He's a fantastic teacher. He's been our leader, really.
That's right, and it's the whole state. It's not just Portland.
He obviously has a wonderful sense of humor. That's the thing that is his biggest attribute. It is the thing that pulls people to him. It's the thing that makes everyone feel comfortable around him.
He can break the tension in a room, and he can make the remark that has everyone laughing.
My understanding was that he got himself through his first few years of medical school there by playing saxophone in the bars in and around Scully Square.
Well, they used to put money in the hat for him and he played the sax?
I hope so. I don't know.
It was always a lot of fun to be with Bob. If you were in a meeting, you knew that you'd get a lot of work done, but you also knew that you were going to have a good time.
He professed to be a golfer, and he had clubs, and I unfortunately had the occasion to play with him a few times. And these were simply painful experiences.
In one of our board meetings, we had a board member who had to drive in from a distance, and she was complaining. And she said, "I don't know why we have to start board meetings at 7:30. Why are we starting at 7:30 in the morning?" And Bob said, "Well, because we didn't want to ask you to be here at 7."
He used to moonlight on nights and weekends when he was in medical school, and he'd make calls in the different hotels around Boston and draw blood. The problem with his situation was that he had his newborn baby with him, and he knocked on the door, and none other than Ted Williams was the patient. He was drawing the blood, and all of a sudden the blanket moved, and Ted Williams said, what do you got in the blanket there anyway?" And at that moment the baby goes, "Wah!" And she had a pacifier in her mouth, and the pacifier came out and hit Williams. He had a bad reputation as being mean at times, you know, so Bob was scared that something was going to happen, and he brought the baby in to pacify Williams. But he's such a politician that he arranged for Williams to autograph the pacifier, and he's the only guy that has an autographed pacifier by Williams in the whole world, and he still has it.
Bob has been at the heart of the Hanley Center since it was just a twinkle in my mother's eye. He has been a guiding force for us in taking the center from an idea to a reality. He was one of the first people to speak publicly about the importance of leadership and collaborative leadership in particular, and he's been a guiding force in making the center a reality from day one.
He's the model of a servant leader, in my view. He always looks for what's the best thing for the organization, for the state of Maine.
Think of Bob as being the physician of physicians. He's taking care of our physical needs, and he's also been very attentive to our professional needs.
I think what we're most excited about in having the leadership program named after Bob is the legacy of Bob's work going forward and what that will mean for patients in Maine and for caregivers within the state and beyond.
In 2012, embark on this kind of a effort is a real tribute to both the legacy of Dr. Dan Hanley and Dr. Robert McAfee, certainly the two most influential physicians in Maine in the last 50 years.
I shudder to think what might have happened if he had not been around to provide the kind of leadership they did both locally and nationally.